Dr. Nick here, and I just want to talk to you a little bit today about one of my favorite subjects, which is running, and specifically how to prevent injuries and run better. So specifically, I want to talk about this idea that's out there that you need to be running with nothing on your foot, barefoot running, or a very minimalist style of shoe to run safely. And where that comes from, there's a popular book, a best-selling book out there by Christopher McDougall called Born to Run. Really started a kind of a craze, new trends, new fads in running, specifically the idea of barefoot running. So is that what we should be doing to run safer and run better? Well, research tells us that it's not as important what we have on our feet or even what part of our foot hits the ground first. That's kind of what came out of the book. Was the main problem is don't land on your heel when you're running, like I'm doing here, which is how we land or should when we're walking. Running and walking are different. So yeah, we definitely want to avoid, if possible, landing on the heel. When we do that, that's like putting the brakes on. It effectively slows you down and wastes a lot of energy having to get started again. And the ground reaction forces that come out of that go up through the leg, through the joints, are greatly exaggerated when you do that. And so the book and the ideas coming out of that basically started this idea that you should land on your toes, land on the ball of your foot or the toes. Otherwise called forefoot striking. And this idea of running as if you were barefoot or even running barefoot. And it cited these different indigenous tribes in Africa and in Mexico and all over the world who are culturally running people. And they run barefoot or at most with very little, like thin, very, very thin sandals on their feet. And that promotes more of a forefoot strike. Well, the problem with that is it doesn't work for everybody, depending on your what we call your heel cord, your Achilles tendon, and where that connects, where that attaches into your foot. Running on your toes can put a lot of strain and stress on those tissues and be problematic for people. So at the very least, you really want to gradually work up to more of a forefoot strike if you're going to go that way. But what I want to say today is that the research shows us that it's less important what part of your foot strikes the ground first with each stride. What's more important is where in relation to your body your foot makes contact to the ground. So if you're going to heel strike or if you're going to forefoot strike, what's most important is that your foot hits the ground as close to directly underneath your center of mass or your body as possible. We can't probably get directly underneath, but we can get really, really close. And so what you want to do is try to contact the ground with each stride as close to underneath your hips and your torso as possible, so that your knee and your ankle are really in line with the rest of your body there. And so you want to think about more of a circular kind of a rotation, almost like you'd see a horse doing in their gait cycle. And so you're coming around and you're reaching out, but you're not contacting the ground until your foot is back to more or less underneath your body again. And if you're doing that, it doesn't matter so much if your heel touches first and then you roll onto your toes to push off, or if your toes touch first, the ball of your foot, and you spring from there. Most often, you're going to find you do more of a whole foot or flat foot contact when your gait pattern is like that, and that's going to give you your best efficiency. So again, that's most important, is that you're contacting the ground, your foot more or less underneath your body, or as close to that as you can, versus way out in front of you, which is the typical heel striking pattern. It promotes getting way out in front, hitting with the heel, and that's where you get a lot of your ankle, knee, hip, low back injury issues. And so the shoe choice doesn't matter as much, although the thicker the padding, it promotes more of the heel strike out in front, and the thinner the padding, the thinner the cushioning, promotes more of a mid to forefoot pattern. So look at how you run. Get someone to take a video, or just assess yourself as you're running. Look where your foot is landing. Do I feel it more on my toe, more on the ball of my foot, more midfoot? Kind of assess. If you're having pain, come see us here at Antioch. See a physical therapist that can work on your gait pattern with you and work out what's causing your pain. And also check out on our website, we've got a series of blog posts with more information on this topic.